This is the panel of bashful people. So we're going to jump right in. Good to see you both. You don't think we're on the wrong panel of bashful people? I just wanted to take this opportunity to personally thank the IOM and my fellow members of this forum for the 2 days. I mean, I came to you with an impassioned plea. This is so important, and I just want to thank you. The way I have thanked you is to be here. This is so important that I will be here, and I'm not going to come tomorrow, but I will be here on this issue. It is so important that everything that we do in this respect is worth it. So I wanted to thank you. It was also very important to me that Carol came from the White House yesterday, and I think that demonstrates that the Obama administration is committed to this issue. We are represented here by several federal agencies, my colleagues at HHS, the Office of Women's Health, the CDC, the NIA and NIH, CMS. I mean, you have seen a good showing from HHS, the Department of, I've got a list, Edwin, thank you. The FTC. Ed would like for me to next recognize the FTC, for David for him being here, the Consumer Financial Protection Bureau, and of course the Department of Justice. So there are good showings here from the federal government, but having passed civics years ago, we also know that there are congressional staff members who've been attending, and that this really does take an executive and congressional kind of work, and we're quite willing to continue to work with members of Congress who are interested in this issue. So I just wanted to thank you all, and also kind of say on behalf of the administration, it's nice to see my colleagues here, that this is not just about the leadership at the Administration for Community Living at AOA. I also just want to give a shout out to I feel like I've won the Oscar, I'm thanking all the people. I want to give a shout out to my staff, many of whom who've been over on this side of the room. Edwin Walker is the most visible person who serves as the Deputy Assistant Secretary, and you've had a chance to meet. But I have many other staff who've been in the room. One of the things that I've learned that I am capable of doing is overwhelming my staff with work. And this is one of those areas that's so large. They have been troopers from the beginning that we started really doing more. And I have really wonderful, I just can't see them over the podium, but really wonderful and dedicated staff who have been steady, continue to support the Elder Justice Coordinating Council, the working group, and this little grid we came up with about how we're going to move all of these issues forward at the same time. I had just a couple of observations, kind of reflections, and they're not necessarily connected other than the fact they're about elder abuse, and we've talked about them. I wanted to go back. Is Pam Teaster still here? I talked to you in the hallway yesterday. Your presentation was very helpful to me, especially slide 1, and this being an atheoretical kind of endeavor that sort of helped me at this point understand that we really don't have a structure by which we are analyzing this work. I was trained in 1984, which is amazing to me now, in domestic violence. That's when I became a volunteer at the Battered Women's Shelter, so I'm familiar with Lenore Walker's cycle of violence, the power and control wheel. So when you talk about needing a conceptual framework, I understand that no one has brought me something like that for elder abuse, because really at this point that's what we're struggling with. So as we move forward to develop a conceptual framework, I have 2 thoughts or concerns that I think we should just add to the conversation. I believe that part of our success in the work of domestic violence was the critical support and training it took for law enforcement to be with us. I believe that abuse of older people is a crime, and that whatever the theoretical framework, it has to be something that can translate to law enforcement, to prosecutors, to judges, that we can also characterize this as a criminal activity. I am also aware that there are complexities, there are gray areas, but if we come up with a theoretical framework that a prosecutor then doesn't understand, or in any way lets them off the hook for doing this work, we will not have achieved the very significant step of making this a criminal activity, and it is. So how does the theoretical framework support that? The other thought, since there was some Q&A with Pam about the public health model, I wanted to give you just some feedback. I am what you see. I'm trained as a lawyer. I've got a career in public service. I have struggled with the public health structure of primary, secondary, and tertiary because of ageism. And this continues to be a problem now in my job was a problem when I was at the state level, because articulating primary prevention for older people is very hard to do. And every time I've talked about primary, to me it becomes a stalking horse for children. And this becomes a challenge for us. I've tried different strategies within my own department about talking about a lifespan approach, because it's kind of unnecessary and stupid to pit generations against each other. I mean, say, but a lifespan approach, what is the right primary intervention and what are they all across the lifespan? This has seemed helpful, but I think any sort of movement with regard to a public health theory, I would almost put it on its head and say, well, for us it's tertiary first, and then secondary, and then primary, because primary is such a struggle. I have had political traction in two ways in advancing primary with regard to older people, and that's to talk about false prevention, because it says prevention, so that's been helpful, and medication management. I still believe that medication management and polypharmacy is a primary level intervention for older people. So I'm willing, really, I want someone to tell me what the model is, train me on the model, and if it can achieve these objectives of overcoming ageism and making sure we're criminal, then I think I can work really with any kind of structure that the researchers and kind of the specialists in theory can present. I wanted to also talk about my longer title. I'm very honored to serve as Assistant Secretary for Aging, but for the last year I've also served as the administrator of our new Administration for Community Living. And I have been talking publicly about what this means for my work individually and the work of the agency. We have built an agency that is serving people with disabilities and people who are older and their families. And we are doing this in a way that is taking what I'm now calling a multicultural approach to aging and disability, to make sure that we're not all the same, in the same way that multiculturalism isn't about being the same. But we must exist in a space that works in concert, that respects difference and aims toward common goals. And in this regard, I do want to talk specifically about people with disabilities who are abused. That has not been the focus of the workshop. I will continue to lead in this space primarily with my Assistant Secretary for Aging hat. I want to frame this as elder abuse because of the social movement that's needed. But as we start working on issues, we must be competent in those issues, that we are doing this in such a way that we are addressing the needs of people with disabilities who are not older, and that people with disabilities themselves are included in these conversations. I really do believe nothing about us without us, the credo of people with disabilities and their work. And we have touched upon those only by describing some of the diseases in the last 2 days. Alzheimer's affects people of all ages, even though there's a higher prevalence for people who are older. But we've also mentioned Parkinson's disease, MS. These are not age-specific diseases. These are diseases that impact people of various ages. So how can we make sure when we tackle these two twin pillars that we've talked about, cognitive impairment and social isolation, that our movement in those two fields is competent enough to include people with disabilities in the development and implementation of those concepts, because they will impact them, and we have to be more than sensitive. We have to be capable of doing that work from disability space. I also wanted to just talk about global concerns. I mean, this really is a forum on global violence. I'm very aware of being here representing the United States, and that we have critical need and desire to partner with other countries and work in this space. I have, and I said this when I started, I have more interest than I have money. At this point, I really am quite interested in international engagement. And the longer I'm in this job, the more opportunities I have, and then the more my budget keeps getting cut. So I have some practical challenges. But I very much am interested in, when I went to the United Nations Economic Cooperation in Europe meeting in Vienna, and I had my 5 minutes, I talked about elder abuse, that I'm wanting to make sure that as I have the opportunity to move in international work, in global work, whether it's Help Age International, I'm attending the WHO meeting in Geneva at the end of next month, talking about aging, that I incorporate this. So I am very interested in the international perspective and participating as a leader from the United States government in that conversation. I also know that there are many advocates in the room talking about the Convention for the Rights of Older Persons. And as I look at the convention, at least the name, there's 4 important words, and I think the United States has agreed on 3 of them: the rights of older persons. And with regard to the convention, what I want to say is I'm listening. I'm listening, and the United States understands the value of the rights of older persons. And so how do we remain engaged, participate in conversations, and let me ask the questions, do the work inside, continue to work with international partners, and figure out, what is the best way that this country can continue to participate and move forward. I can't do anything other than that at this point, but to say, I understand the reason the issue is presented. I don't worry about it being presented. I certainly think that we have demonstrated our interest in the rights of older persons, and we must continue the conversation. With regard to moving forward, what can I do? Other than talking to a lot of people, which I do, I want to focus specifically on adult protective services and the Elder Justice Act. I have been a career public servant. I am troubled. Every year a law sits unfunded because new ideas come up every single year, and the members of the legislature, the members of Congress, have competing interests. So the fact that the Elder Justice Act has not been funded is a tremendous, tremendous problem. I will keep working as I can, a little bit to the degree that $8 million is a little bit in the 14 budget, to continue to work in this space. One of the things that I think Bob mentioned was a desire that we designate a federal home for adult protective services. Without going out on a big limb, I could probably get that done. What does it mean? Because the authority that I have now, right now, to work in this space is the authority I have under the Older Americans Act and the money that goes with it. So we could fund an APS resource center because elder abuse has always been incorporated into the accomplishments and missions and goals of the Older Americans Act. So I can work on elder abuse with my Older Americans Act funding. If you, writ large, want me as the Assistant Secretary and Administrator to work on the Elder Justice Act, I can't do that without Elder Justice Act funding. And so to be a federal home for APS means that we would want to work even more comprehensively than we've been able to. And there are limitations with regard to lack of funding. And what I try to impress upon people on the Hill when I talk about this and internally is, money gives you more than money. Money gives you jurisdiction. And this is part of kind of the two-edged sword of things, or the two things, the duality of things that are missing now by not funding the Elder Justice Act, is the authority and the funding to move in that space. I just wanted to then completely end where I started and say I've sat here for 2 days and I think I was right. So I've learned some stuff, but I do believe completely that we have assets at hand, that this is a little bit of other things we've been working on, that we need to go back and redouble our efforts with suicide prevention and mental health services and domestic violence, child abuse. Now on child abuse, I must tell you I have an asterisk beside that, because I don't think we should treat adults as children, but I think we should learn about the vulnerabilities and the policies and the strategies that came from child abuse that were so successful. But I think there's all of these fields that we can learn from that we need to revisit to strengthen our efforts. But the two issues that we must advance directly, the things that are specific here, are these issues of cognitive impairment and social isolation. How do we continue? This is the elder abuse sweet spot that none of those other domains will shape in the way that we need for it to be shaped and advanced. So I just want to thank you. I'm very optimistic. We have wonderful talent, wonderful resources. We have more brains than money, but we'll get there. So thank you all very much.